Imagine labor with significantly less pain, allowing you to experience the joy of bringing your baby into the world. Today, let's uncover the secrets of epidural analgesia, a game changer in pain management during delivery. Hi, I'm Dr. Shubhiaggarwal and I welcome you all to Viscure, a platform where we dive into everything from pregnancy and contraception to sex education and beyond. Today is the 6th episode of the series Blossoming Bellies, your guide to a healthy pregnancy, where we'll talk about painless labor. I have received a few questions from many of you and I'm going to answer them one by one. But before starting, let us talk about what is epidural analgesia. Epidural analgesia is a method of pain relief that is used very commonly during labor. So what happens is a pain medication, analgesic, it is injected into your lower back, which helps in numbing your lower limbs. Your limbs become numb so that you cannot feel the pain, but it also allows you to be active and alert throughout labor so that you can feel those contractions and you can participate in the birthing process. Epidural analgesia is now becoming one of the most popular choices for the moms to be for a smoother labor experience. Let's dive into the question one by one. So, number one, how is an epidural administered? Okay, so your healthcare provider, anesthesiologist, they insert a needle into your lower back. When they reach the epidural space is the space around your spinal cord, and when they reach the epidural space, a catheter is inserted. Now the pain medication is delivered through this catheter with the help of a pump which is calibrated to deliver the exact amount of dose that is needed for optimal pain relief. When is an epidural given during labor? So it can be given at any point of time when the labor pains start. There is no specific cutoff as the cervix has to be dilated up to a certain limit. Earlier there was a cutoff that it should be given only in active labor, that is the cervix has to be dilated minimum 4 centimeters. You can give epidural as early as when the patient arrives at the hospital with the complaint of labor pains. How long does it take for an epidural to work? So the pain relief from an epidural usually starts after 10 to 20 minutes after delivering the drug. Adjustments can be made to the dosage to provide continuous and optimal pain relief throughout labor. Can I move around after getting an epidural? Okay, so your lower limbs are numb, so you will likely to have a little less mobility as you were having earlier. So you're going to have difficulty in standing up or walking on your own, but you can achieve the same with the help of some assistance. But still, we advise you to lie down throughout the process of labor because there can be some tripping while going to the toilet also. Does getting an epidural hurt? Okay, so think of it this way, a needle is getting inserted. So you're going to feel pain, you're going to feel discomfort, you're going to feel pressure at the site of injection. But it is well tolerated because we apply local anesthetic to numb the area before inserting the needle. Apart from that, there is no pain. It only helps in pain relief. What are the benefits of an epidural? Needless to say, the name painless delivery says it all. You're going to experience very little pain while going through the labor process. It is also seen that it helps in cervical dilatation also, and some researchers has also proved that it reduces the chances of postpartum depression. It reduces the levels of cortisol, the stress hormone, during labor. Are there any side effects or are there any risks associated with an epidural? So a very common side effect that is associated with an epidural is sudden drop in the blood pressure, for which your blood pressure will be monitored continuously. There may also be a temporary difficulty in urination, for which a catheter may be inserted to empty your bladder. There might also be some heaviness or tingling sensations in your legs even after childbirth, but that is very short-lived. Once the drug wears off completely, your legs are just fine. Okay, rare but serious side effects. Nerve damage. This is very rare. It happens only in 1% cases, and even if it happens, it is temporary and it can be treated very easily. So you do not have to worry about that. Can everyone have an epidural? No, not everyone is an ideal candidate for an epidural. People who are on blood thinners, people with certain blood disorders, people who have a history of lower back surgery, there is infection on the site of injection, or people who have low platelet counts, or even sometimes the anesthetist cannot locate the epidural space properly. In these cases, epidural is better not given. Will an epidural affect my baby? No, epidurals are generally safe for the mother as well as the baby. You might have read on internet that there are some drugs which can cross the placenta, but the amounts are usually minimal and they are unlikely to affect your baby. How long does the pain relief from an epidural last? As long as the catheter remains in place, as long as the drug is getting delivered properly, pain relief is going to last. Can I still push with an epidural? Yes, you can still push with an epidural during your delivery because the amount of drug is given in such a way that it numbs your limbs so that you do not feel the pain, but it keeps you active and alert so that you can push effectively and you can participate in the birthing process. How soon after an epidural can I walk? So after the epidural is stopped, it might take a few hours to wear off the drug completely. So your healthcare provider will assess when it is safe for you to walk. Okay, so that's all for the day. I hope that this video provided you with a clear and concise understanding of epidural analgesia of painless delivery, and you might also consider epidural as your partner for your delivery. If you like this video, do not forget to like, share and subscribe. Thank you.